Hey guys, this is Dr. Joe Borio with Borio Chiropractic, and I wanted to go over a case. I'm trying to do this every day I'm in the office to give, I think, a greater understanding, not only of the significance of some of the problems that people suffer with, but I think the significance and the importance and really the necessity of taking care of your spine, using the chiropractor like a dentist and taking care of you and your child's spine now rather than waiting till, if you will, we got tooth decay and disease developing. So I wanted to share some cases with you to show you what I mean, to lead you some deeper understanding. So what I did is I brought up a file here of a healthy practice member. So a person that we take care of that's healthy. I want to start with that first, just for a minute, and show you a little bit of what we're looking for. So we have a gentleman that comes in the office recently and he feels horrible. His lower back is chronic, not what I would call severe or acute or what we would consider disabling right now, but he's just in chronic long-term back pain. And he also, in taking his history, he's got all these digestive problems, where the IBS and the digestive, and he's has had issues with inflammation of his bowel, and he's getting different types of treatment, medical treatment for it. But when he comes in here, we want to take a look at his spine. We want to take a look at his nervous system, even more importantly, okay? So I want to show you this really quick. This is a healthy spine. This is what your spine should look like, okay? So when I look here, I want you to see there's a curve in the spine. There's a beautiful curve. And then what you're going to see here is there's going to be some beautiful spaces. So you're going to see all these beautiful spaces in between the spine. And that is important. So when I look at you from the front, you should be straight. And when I look at you from the side, nature, God gave you these beautiful curves, and that allows your spine to have spacing, and it allows your spine to act as like a shock absorber. So here's the spine model. This would be the disc. This is where the nerve comes out. So we're going to see like a beautiful spacing of the spine. Now I'm going to show you this guy. So here's this guy, comes in the office. I don't want to give his name, obviously. Okay, so let's look at his x-ray, right? And when you look at that, hopefully you're getting a pit in your stomach, because I've been doing this 29 years and I literally still get a pit in my stomach, right? So here's a guy, never been to the chiropractor. When somebody says that to me, it literally says to me, like, I've never been to the dentist. I've never taken care of my teeth. They're going to get what? Tooth decay. They're going to rot. I've never taken care of my spine. It's bones like your teeth. Now I'm developing rot or decay in my spine. So when we look at his lower back, here we've got a space, but what you're seeing is all these gaps here. A curve. But here what we're seeing is we're losing spacing. So he has no spacing here. He has no spacing here. He's got spurring, compression throughout multiple areas of his spine. All these areas are now, if you will, decaying, deteriorating, degenerating, right? And that's all from his spine not being in good alignment, right? So what happens is the spine loses mobility and alignment. Now, there's a really important word for that condition, unfortunately, when that condition presents in all of us, and that's called a subluxation. And that means this spine is either stuck, the vertebrae gets stuck, or it gets crooked, and now it's starting to rub against the joint, causes degeneration. So now the question is, why would this guy, because that's what he asked me, he said, hey, Dr. Joe, I appreciate this, but why am I getting digestive trouble? That's a great question, right? So this is one of those things we know, but we don't often think about. So I don't mean to cut myself off here, but so I want us to look at this. We know this guy right here is like a computer, right? There's my brain, tells my body what to do, right? So there's my brain, and these are all the organs in my body. So when I look at him here, look at his system here. This is where his spine's getting sick, right there. Now I'm going to bring you over here. Look at this part of the spine. Where does that go? It makes up the celiac node, which goes all the way to the digestive system. So as this area of his spine got sicker for years, this area of his body is getting what, right? Because my brain is like a computer, sends messages down out to the organs. My spine's getting crooked, It's getting subluxated, it's getting deteriorated, and then it presses on the nerves, and then what happens to the health of the organ? What happens to your stomach? Like, ask yourself that question. What's going to happen to my stomach if I press on the nerve that tells it what to do? What's going to happen to my heart, my lung, my kidney? So you're going to see people go to the chiropractor and they'll say, wow, I started going to the chiropractor, I don't get dizzy anymore. Or my asthma's better, or my digestive better. It's not even that it's a treatment for that. What it means, though, is anytime the spine is out of alignment, subluxated, it affects the nerves, and those areas of the body aren't working better. So I just started adjusting this guy. I mean, literally, I've adjusted him maybe a month. So I just started. And what's beautiful in this case is, and which happens frequently in here, because he's feeling more comfortable, so he's not suffering from chronic back pain as much. But what's even more beautiful is his digestive system's healthier. Hey, Dr. Joe, you know what? I'm not getting that IBS. I'm not getting that bloating, that cramping. And that would mean that the nerve impulses, the messages that go through here, they're obviously getting to the digestive system better, and his body's getting healthier. And that's really one of many reasons. The next question I would ask you is, when did his spine go out of alignment? Like, how long did it take to get like that, right? And that would be what? What's the answer? What are you thinking? That would be a really long time. So how long does it take to get well? That's the next question, right? If it took 30, 40 years to get that bad, how long would it take to get well? And then once I get you well, what would be my job? Like, what's my job? Why did he get sick? Because he wasn't taking care of it. So the reality is, once I get you well, my job would be to keep you well. So whether you choose to do that or not, but just like a dentist, as the spine gets healthier, it's better to take care of it, continue with some care so that the spine stays healthy. I'll tell you the last thing, not to ramble on here, but the last thing is this. Imagine if you will, if this guy got in when he was a kid. Imagine if his mom and dad said, hey, listen, I'm going to bring you in, Billy, now when you're little to keep your spine healthy so it doesn't get sick in the first place. He doesn't rot. He doesn't have chronic pain. He doesn't have digestive problems or what else. Who else knows what else is going on in the body? Like, all of those things don't happen now, or much less likely to happen, because he's getting taken care of. That's why we always talk to you about bringing the kids in. We insist on checking children and babies to see where their spine is out of alignment or subluxated, so they don't develop the same problems that we see far too often in adulthood. So, hey, thanks for giving me a few minutes today. If you like what we're doing here, maybe you have a loved one, a family member, a friend, and you'd like to share this video with them, I would certainly encourage you to do that. Also, if you like what we're doing, certainly share it to your own page or share it in a message to somebody that you care about that's looking, whether they're local or not. If they're local, I'm in central New York. It's really an honor to take care of people. If they're not local, by all means, reach out to me, and I'll make sure I find them somebody that a chiropractor in their area that's going to really take great care of them. I'd really like to be a part of that journey of their health, whether directly or indirectly. Okay? Again, thanks for giving me a few minutes, guys. Give us a call at the link above, and you can reach out to us on our webpage, which is BorioChiropractic.com, or at the phone number directly above, or there's right on our Facebook page. And we'd love to talk to you more, and we'd love to have the opportunity to take a look at you, certainly in you and the rest of your family, to get you guys healthy and live a better life, stronger life. Straighter is healthier. There's no health in crooked, guys. All right, guys, until next week, have a great week.